Hi, everyone. Thank you very much for the informative talk, Professor Zamir. We move on to another debate, the aortic dissections. So, what is aortic dissection? Aortic dissection is when something that Dr. Zamir has touched on, when the inner layer tears. Imagine if there's a dam that keeps the water intact and there's a crack. So on its own, the dam actually will keep the water, no matter how much the force is, it will keep it intact. But when there's a crack, the water seeps in, and before you know it, the dam is unstable and it's all going to fall apart. Similarly, in aorta, it keeps all the blood from the heart to all the organs and keeps us going. But once there's a defect in the wall, it all falls apart. As we found out earlier, the aorta is the largest blood vessel that comes off the heart. It supplies even the heart itself, and yeah, and there are three layers. So when blood goes where it's not supposed to go, where there's a tear, you disrupt blood flow, affecting all the organs. And aortic dissection is a serious life-threatening condition that requires prompt medical attention and treatment. So here we have some pictures where there's a classic dissection where there's a tear in the layers and blood is going through two channels instead of one. Or we have more like a intramural hematoma. It's like a bruising of the wall, but blood has seeped through the layers. So a structure which is actually very sturdy now has become a bit unstable. So depending where it is, which part of the aorta it is, the treatment is very different, but it's a condition that it needs to be taken seriously. Then we have penetrating atherosclerotic aortic ulcer. All of us have cholesterol from the age of 14. Some have more, some have less, but all these become a problem once there's a disruption. Once there's a disruption, again, once the wall is a weakening, the risk of the whole structure falling apart. As you can see, the blood flow, when it's going through the right channel, goes to the organs properly. But once there's two channels and and the other layer becomes bigger and the channels becomes bigger, the organs, kidneys, whether your legs, your brain may have been devoid of a blood supply, which causes problems. And depending where the tear happens, when it's very close to the heart, like the first two pictures, and when it's away from the heart, the management is completely different. So we like to use this common classification, Stanford classification. The first two indicate A, the next one indicates B. So A would mean emergent surgery. B would be a bit more conservative with blood pressure control, but may have delayed intervention required. So what causes aortic dissection? High blood pressure is one of the most common things in our population because as we age, our blood pressure needs to be managed appropriately. So when we're young, blood pressure 110, 120, it's okay. But once we are getting older, with life catches up and we are having 140, 150, we need to bring it down because it causes a weakening of the structure, the aortic structure. And genetic conditions. So we do find patients with Marfan and Ehlers-Danlos syndrome in Singapore, but they're very rare. But we do have a bit, means very few family histories, but actually they're quite significant. So I've met a patient with aortic dissection, and they're the only family who knew what was aortic dissection because it has happened in generations in our family. Because when they were young, our aunt died at the age of 40, and when their mother came in at 60, oh yeah, we know what's aortic dissection. It's a bit surprising because aortic dissection is not as common as heart attack for everyone to know. Chest injuries. So we live in Singapore. Our main form of chest injuries will be a road traffic accident. All this deceleration and acceleration injuries causes a lot of damage to the aorta. And the most common symptom will be severe tearing chest pain. And sometimes they present with shortness of breath because blood has accumulated from the aorta and seeped around the heart and is pressing on the heart. And eventually prevents the lungs from clearing all this water. And sometimes what happens, the dissection causes the aortic wall to swell and presses on the feeding tube of the body. And sometimes the aorta cuts off blood supply to the legs. where a lot of people come in with, I can't move my leg suddenly. So how do you get a diagnosis? There are many ways to get a diagnosis. We have moved on to ultrasound, MRI, but the one that gets you in and out promptly and with an ideal diagnosis is a CT scan. So what do we do after? So depending where the location of the aortic dissection is, when it's very close to the heart, it involves emergency surgery. The surgery can be, the minimum you have to replace is the ascending aorta, which means it doesn't involve the arteries to the heart. Sometimes it tears all the way down to the arteries to the heart, which means you need a full aortic root replacement, which means we have to change the valve and change the full works. Sometimes the dissection is so extensive, it affects the blood vessels that go to your brain and your upper limbs. Then we have a full arch. Open surgery is not walk in the park, to be honest. There's a lot of downtime. Stay in hospital can be considerable. And aortic dissection, as you can see, it affects every organ that is to affect, from the brain to your pinky toe. So problems in post-operative recovery can be very challenging to treat. And aortic dissection is a lifelong disease. So we need repeat open surgery or endovascular surgery, but once for sure, so you need to be kept on surveillance.